Healthcare is an ever-changing field that requires knowledge of both individual roles and teamwork to be successful. To provide excellent patient care, no one person is responsible. Instead, it is the collaborative effort of multiple persons in different roles that make a patient's recovery a success. This type of teamwork in the medical field can be found in something called an interdisciplinary team. An interdisciplinary team is more than different healthcare providers working in their individual roles to care for a patient. A true interdisciplinary team provides patient care not only by fulfilling their individual roles, but by also knowing what the other team members are responsible for, understanding the importance of communication between the different care areas so that a continuum of care can be established. Through interprofessional studies, medical professionals in training can learn how individual roles can affect patient care, and how those individual roles work together to create an interdisciplinary team and provide patient care through a team approach. There are many different settings where you might find different healthcare professionals working together as an interdisciplinary team. Some examples might be an acute care hospital, a medical clinic, home health agencies, or a nursing home. Another setting where interdisciplinary teams are found are in physical rehabilitation hospitals. Health South Rehabilitation Hospital of Texarkana is one example of a healthcare facility that uses the team approach to care for all of their patients. Let's visit with some of Health South's team members and find out how interdisciplinary teams work in their facility.
My name is Todd Wallace. I am a physical therapist.
My name is Dexter Hodge. I'm a nurse. My individual responsibility is we care on the nursing unit, care for the patient medically, while therapy does their thing, getting that patient better functionally. We focus on the medical side of things, making sure that patient is ready for therapy.
Walt Blanchard. I'm a licensed master social worker, and I am also a certified case manager. My basic responsibility is to orient them into the rehab program, introduce them to actual rehab components, to introduce them to the staff that will be coordinating their care, and who their doctor and physician is, and what type of therapy and also care they'll be receiving while here. My role also is to do discharge planning, get with families, schedule interdisciplinary family conferences, and also to do discharge type instructions and set up specifically for families that are going to take patients home, some therapy techniques.
Hello, my name is Lysandra Smiley. I am the Director of Pharmacy here at Health South Rehabilitation Hospital. As far as patient care, when the patient first enters the hospital, pharmacy along with nursing is responsible for getting that patient medication history, so we can have an accurate medication administration record for the patient to use while they're here in the hospital. The other thing we do is monitor the patient's laboratory work on a daily basis to make sure there's nothing that's out of the norm, and if there is something out of the norm, we bring that to the physician's attention so that can be addressed. The last part of what the pharmacy department does is, upon the patient getting ready for discharge, we go to the patient's rooms and talk to them about their medications, answer any questions they may have. We also can elaborate on any medications that are new for them, that they're going home on, that have been started here in the hospital. So we just generally answer any questions. We kind of just do a discharge counseling before they leave.
I am Laura Jenkins, and I'm the lead speech therapist here at Health South. I evaluate and treat patients who have disorders of either communication, cognition, or swallowing.
My name is Casey Ann Clow. I'm an occupational therapist.
My name is Lance Vestal. I'm a senior occupational therapist with Health South here in Texarkana, Texas. In relation to stroke patients, my role is to be sure that patients who've had a stroke can regain use of their involved extremity, which happens often with hemiplegia or hemiparesis, teaching them self-care activities, hemi-dressing techniques, transfer techniques.
To me, an interdisciplinary team is a team made up of everybody who's going to have hands on that patient. Every department who has something to do with that patient's care, all of them being on the same page and working together to create the best outcomes for that patient.
Multiple disciplines, PT, speech, nursing, case management, dietitian, pharmacist, it's just everybody collaborating on the patient to get the best outcomes for them.
On my team, of course, we work with other nurses, nurses being CNAs, LVNs, as well as RNs, and then also therapists, physical therapists, and occupational therapists.
So most closely, the PTs, OTs, and speech language pathologists work closely, but in a rehab setting also you work very closely with the nurses and very closely with the physicians and very closely with dietary. There's just not a single group you don't.
We communicate face-to-face, email, not so much text message because of patient confidentiality, but most of it is face-to-face, different meetings where we get together with all the disciplines and discuss patient care.
Verbally, we do a lot of verbal communication, lots of emails, phone calls. You know, we do kind of mini staffings all day long.
We have team conferences, and they meet once a week, and the physician is there, and everybody's there, the case management, nursing, OT, PT, everybody's there, so we talk to each other then.
Problem solving, we of course communicate. As a team, without communication, a team does not really have the integrity or the success if they do not work together and to solve those problems. We identify those problems and look for the root cause of those problems, and then move forward with the implementation of whatever the outcome is, and set goals, and then also set expectations for the staff. As we educate them, we reevaluate to make sure that what we put in place is functioning.
Usually through case conference. Any adjustments that need to be made. A lot of times the case manager will tell us some things that are happening, and we can adjust through that time. We discuss problems that the patient is having, and come up with some ideas to help adjust their care.
That's kind of what happens in the face-to-face communication. And if there's something that does happen as far as the patient has a change in status, then we get together as a team and discuss that. Every discipline that's involved gets together as a team and discuss what happened. Was it preventable? How can we prevent it from happening the second time? And that sort of thing.
Usually we pretty much talk it out, like, is this happening or why isn't this happening? Basically we're responsible to that patient, and that's why we're here. So if something's not happening, we'll find out why.
Well, we have a system of checks and balances. Each person on the team has a role, and when something isn't taken care of, you have to go back and actually sit down and try and figure out how we're going to get that addressed so nobody falls through the crack.
We work them out. Usually we work them out before it ever has to go beyond the two individuals. Usually if an issue comes up, we want to nip it in the bud very quickly, because ultimately we're all here for the patient, and we don't want things to ever get to that issue where we have to discuss it outside of the realm of the clinicians at hand. So we'll have informal sessions, sit down together, talk it out.
So how does teamwork affect patient care? In healthcare, interdisciplinary teams use collaboration, communication, goal setting, and accountability. It is a teamwork that builds a success story for patients. Interprofessional relationships are a core piece of a healthcare environment. Through understanding the importance of your own individual role and that of your team members, you can provide the kind of care that makes your patient have a success story too.